Hey, my name is Baize. I'm a student physical therapist assistant, and today I have scenario number 5. My patient has a strong fear of falling, and she has weakness in her lower extremities. She also has double vision in her right eye, and she cannot see out of her left eye at all. Her past medical history includes a triple bypass surgery, a retinal detachment, and she is currently losing about 3 pounds a night due to her diuretics she's taking. Our short-term goal we are going to work on is for our patient to demonstrate the tug test in under 15 seconds. And our second short-term goal we are going to work on is for our patient to demonstrate her home exercise program independently. Hello, Ms. Baize. How are you doing today?
Good, how are you?
Good. My name is Baize, and I'll be your student physical therapist assistant today, okay?
Okay.
I see. How are you doing at home? Are you still having trouble falling?
I haven't fell recently, but I feel like I'm gonna fall a lot.
So you're gonna fall all the time, but you haven't fallen recently, though.
No.
Okay, good. I see we still have some weakness in the legs, so we're gonna test how strong your legs are, okay?
Okay.
All right. So if you can you scoot forward for me? Yeah, just like that. And if you can you kick your toe to the ceiling, please? Good. And can you do that with the other leg? Good. All right. So do the same thing. Come up, kick your leg, and then take it off a little bit, and then I'm gonna resist, and I want you to don't let me move you, okay? Yeah. It's kind of hard. Okay, that's good. Same thing with this leg. So can you do toe to ceiling? Back off. Oh, is that hard?
Yeah.
Okay, good stuff. All right, and what we're gonna have you do is, can you please lay on your stomach, and we're gonna see how much motion you have in your hip. How much motion you have in your hip, okay?
Okay.
So first, what I want you to do is, can you bring your heel to the ceiling for me? Good, and hold that. Good. All right, and we're gonna do the same thing with this leg. Can you bring this heel to the ceiling for me, please? Good. All right, Ms. Baize, we're gonna do some balancing activities today. Is that okay? All right, so I know you have a strong fear of falling, so what I'm gonna do is I'm gonna wrap this around you just in case, okay?
Okay.
This helps me and you feel a little better.
Awesome.
And how are you using your cane at home? Are you using this every day or just a little bit?
I do use it, yes.
Yes?
It helps me feel like I'm not gonna fall.
Okay, good. We can keep using that.
Okay.
And excuse my hands. Tight. There's a lot of extra room for this belt.
Yeah. They make kids ones?
No. Yeah. All right, and go ahead and stand up for me.
Okay.
Good, and we're gonna walk over here. Good. Good job. All right, and you can go ahead and we'll take this from you. Yes. All right, and if you want to, you can go ahead and walk straight through. And so first, our activities, what we're going to do is you're trying not to use the parallel bars only as much as you need, but
Okay.
put one foot in front of the other. All right, and we're going to do balancing activities, okay?
Okay.
So I got you if you need to, and try not to use the parallel bars.
Okay.
And we're going to do this 30 seconds for twice, okay?
Okay.
Good. Start. Good.
This is hard.
Yes, it is very hard. Oh, good job. I got you. All right, now it's 30 seconds. We're gonna do that. We're gonna do that 3 times, okay?
Okay.
With that foot. And now we're gonna move on to the next foot. So have you switch feet and put your other foot in front of the other. And we're gonna do this for 30 seconds.
Okay.
All right, and same thing. Try not to use the bars if you can.
Okay.
Take it. And we're gonna do that for 30 seconds, and all right, 30 seconds. All right, we're gonna do that 3 times, okay?
Okay.
Good. So now what we're gonna do is we're gonna practice weight shifting. So if you can you turn towards me? Yeah. All right, and for our next activity, we're gonna do some weight shifting, okay? So now what we're gonna do is I want you to shift all your body weight from each foot side to side, okay? And we're gonna do this for 30 seconds.
Okay.
And try not to use the parallel bars if you can.
Okay.
All right, so start. I want you to shift all your weight to your right. Yep, good. And then go all the way back to the left. Good. Good. And we're gonna do this for 30 seconds. All right, good. And rest. How's that?
Fine.
That was fine?
Yeah.
Good. All right, so now, and we're gonna do that 3 times each.
Okay.
So now what we're gonna do, see there? So now what we're gonna do is just like the first activity, except this is gonna be a little bit harder, okay?
Okay.
So once you put one foot in front of the other, so come on, yep. Good, good. Yeah, it's gonna be a little bit more difficult, okay?
Okay.
So what we're gonna do this for 15 seconds each time. We're gonna do this 4 times, okay?
That's a lot.
That's why we're doing 15 seconds.
Okay.
All right, so 15 seconds.
Okay.
All right, good. And rest. How was that?
Fine.
Fine? It's kind of hard?
Yeah.
Okay. All right. Then good. And we're gonna do that 4 times. And now after we're done with that, we're gonna switch your feet, please. Yeah, we're gonna do the other way. Okay. Ready? Is this way harder? Good. All right, and Miss Byers, here's your cane again.
Okay.
All right, and if you'd like, Ken, can we come over here to this mat and sit down?
Sure.
Good. All right, sit down for me. All right, so I want to look at one thing. I noticed on a tug score was a little low, so we're gonna see how you can get up. So if you can for me, just show me how you stand up, please.
Okay.
Oh, all right, all right, all right. So we're gonna fix a couple things, okay?
Okay.
All right, so sit back down for me. All right, so you're gonna have your feet wide on your shoulder length apart, and you're gonna push off with your hands from this side, okay?
Okay.
And you're gonna do it at the same time. All right, so can you try it one more time? So try to stand up. Good, how'd that feel?
Fine.
Better? Okay. All right, so sit back down. All right, so let's do 10 of these, okay? Just doing that. All right. All right. Good. And it helps if you lean all your weight forward when you get up. Just like that, yep.
I just feel like if I lean too far, I'm gonna fall.
Oh, don't worry, you're not gonna fall. I got you, okay? So we got this belt on you. You ain't going nowhere. And 10. All right, so rest, and you're gonna do that 2 more times for 10. All right, good stuff. So now we're gonna go over your home exercise program, okay?
Okay.
I'm gonna print you out a sheet later that's gonna have all this information. So your first one is called your long arc quads, and this is to help your quads. So what you're gonna do is just extend all the way out, hold, and back down. Mm-hmm. Yep. And you're gonna do 3 sets of 10. And 10. Good job. So next is going to be your heel raises, so if you can. And this is better to find a countertop at home, okay? So this is the countertop. All right, so go ahead and stand for me. All right. Good. Yeah, so make sure to hold on to the countertop the whole time, okay?
Okay.
Because we're going for strength, not balance.
Okay.
So when you do this, you just get your heels off the ground as far as you can go. Good. And I know your stepson lives at home with you, so if he can be around when you're doing this one, that'd be a lot more better. You do 3 sets of 10, okay? And 10. How you feeling? Good? That wasn't too painful?
No.
Okay, good. All right, and for your last one, and we're coming back over here to sit down. Yep. All right, and if you would like to, you can get on your stomach.
Okay. Which way now, please?
All right, and these are going to be your hamstring curls, okay?
Okay.
So if you can, bring your heel to your back. Yep, and that's going to be one. And you should feel it working right here in the back of your leg, okay? And you're going to do 3 sets of 10 with this, and you're going to do this each leg. And same thing with the long arc quads each leg.
Okay.
All right, and Spires, good job. So you can go ahead and sit back up here for me. So here is your home exercise program list that you're going to take home with you. These are your long arc quads, the one where you're sitting. This is your hamstring curls, the one that you just did, and these are the ones I want your son with you if you can by a countertop during your heel raises.
Okay.
So this is yours to take. The only thing I notice is that you're losing a lot of weight taking your diuretics. So you need to know that you taking that medicine is not helping you gain weight. You're eating because you have lost 60 pounds in 3 months, which is not very good. And also keep in mind that with your when balanced, the wider stance of support you have, the more balance you'll have too. Okay, so when you're standing, I want you to have nice wide base of support when you stand. And keep that throughout. Do you have any other questions about today? Do you have any questions about your home exercise program? Do you feel like you can do them all by yourself? All right, good. Thank you, Ms. Byers.